name's Dr. Nathalie MacDermott. I'm a new clinical research fellow at the Institute of Global Health Innovation. We are winning the fight against Ebola at the moment in Africa. Liberia was declared Ebola-free on Saturday, so it's cleared 42 days without any new cases of Ebola, which is great news. And Sierra Leone and Guinea are getting there. Both had about 9 cases in the last week, so that's significantly reduced from previous, and hopefully we're on the homeward stretch. Ebola's had a devastating effect on families in West Africa. It's estimated by UNICEF at the moment there's about 16,600 children who have lost either one or both parents to Ebola. And many of those children have lost their primary caregiver. Fortunately, many have been rehoused within families or with neighbours. Ebola survivor syndrome is a condition that's not yet well defined. It hadn't really been noticed particularly before because there haven't been that many survivors of Ebola from previous epidemics. But since we have now approximately 15,000 survivors, we're seeing patients presenting with joint pains and muscle aches and prolonged fatigue. And one of the most common complaints is eye problems, and in some cases people actually going blind after they've survived Ebola. Weeks to months later they've gone blind. In July, when I was in Liberia, I was working with Dr. Kent Brantley and Nancy Wright-Bowl, who were 2 US aid workers who unfortunately contracted Ebola virus while we were working together. It was a very challenging time. It was not only challenging because my 2 colleagues were sick, but it was challenging because at the time we were the only Ebola treatment unit in Monrovia, whilst cases were escalating rapidly, and we didn't have the capacity to deal with what we were facing at the time. But unfortunately, we also weren't receiving any assistance at the time because the world hadn't really yet woken up to what was going on in West Africa. So that was extremely challenging. And then on my return, I was quarantined in my apartment for 21 days due to my possible exposure to the Ebola virus, largely because we didn't know how Kent and Nancy had contracted Ebola virus. And so at the request of Public Health Wales, I remained in my apartment for 21 days. So my upcoming trip is largely a fact-finding trip and also a trip to engage with the Ministry of Health in Sierra Leone and partners on the ground to set up our research study. The study that I'm working on is part funded by the IGHI and also by the Institutional Strategic Support Fund from the Wellcome Trust. It's looking at whether there's a host predisposing factor to outcome in Ebola virus. So whether there is a genetic reason that some people might survive or some people might die from Ebola virus disease. Collaboration with other institutions and other countries is essential when it comes to combating Ebola. I think we've seen that from this current outbreak. These countries obviously couldn't address the situation themselves, and it's required a worldwide effort to bring it under control. But I think the same goes for research. It's really important that people collaborate on research in this area, particularly when you're talking about disasters or epidemic situations where pre-planning research is quite difficult. We have a limited number of samples, and it's really important that people collaborate so that we can gain the most information we can from what we have available to us. And even though there may be 2 studies which are slightly different, they may work really well in harmony together. So it's really important that we all collaborate with each other in this situation.